Golden Notes. Colorectal cancer. It is the third most common type of cancer in the UK and the second most cause of cancer deaths. Adenocarcinomas comprise the vast majority, 98% of colon and rectal cancers. Location of cancer: averages: rectal 40%, sigmoid 30%, descending colon 5%, transverse colon 10%, and ascending and cecum 15%. Colorectal cancer genetics. There are three types of colon cancer: sporadic 95% and hereditary non-polyps colorectal carcinoma, the HNPCC, which is 5%, and the familial adenomatous polyposis, the FAP, less than 1%. Sporadic colon cancer may be due to a series of genetic mutations. For example, allelic loss of the APC gene, more than half of colon cancers. Further gene abnormalities like activation of the KRAS oncogene. Deletion of P53 and DCC tumor suppressor genes lead to invasive carcinoma. Hereditary non-polyposis colorectal carcinoma, the HNPCC, also known as Lynch syndrome. It is an autosomal dominant mutation of DNA mismatch repair genes with microsatellite instability. It is the most common form of inherited colon cancer. Around 90% of patients develop cancers, often of the proximal colon, which are usually poorly differentiated and highly aggressive. The most common genes involved are MSH2, 60% of cases. So the function of this gene is DNA mismatch repair, and the MLH1, which is 30%. Patients with HNPCC are also at high risk of other cancers, with endometrial cancer being the next most common association after colon cancer. The Amsterdam criteria are sometimes used to aid diagnosis. At least 3 family members with colon cancer. The cases span at least 2 generations, and at least 1 case diagnosed before the age of 50 years. The Tauri syndrome, a type of hereditary non-polyposis colorectal cancer, is characterized by sebaceous adenomas. These lesions are usually present on the face, near the eyes, and forehead, and appear as yellow papules or nodules. Family adenomatous polyposis, the FAP. FAP is a rare autosomal dominant condition which leads to the formation of hundreds of polyps by the age of 30 to 40 years. Patients inevitably develop carcinoma. It is due to a mutation in a tumor suppressor gene called adenomatous polyposis coli gene, APC, located on chromosome 5. Genetic testing can be done by analyzing DNA from a patient's white blood cells. Patients generally have a total colectomy with ileoanal pouch formation in their 20s. Patients with FAP are also at risk from duodenal tumors. A variant of FAP called Gardner's syndrome can also feature osteomas of the skull and mandible, retinal pigmentation, thyroid carcinoma, and epidermoid cyst on the skin. The CEA can be used to monitor for recurrence in patients post-operatively or to assess response to treatment in patients with metastatic disease. Colorectal cancer screening. First of all, we should remember that the positive predictive value of fecal occult blood is between 5 to 15, which means the percentage of patients have positive fecal occult blood that have colorectal cancer is 5 to 15% of the entire patients. The NHS now has a national screening program offering screening every 2 years to all men and women aged 60 to 74 years. Remember that a negative fecal occult blood does not exclude an underlying diagnosis of colorectal cancer. Now, any patient with symptoms, irrespective of a negative fecal occult blood test, should be investigated for the possibility of underlying bowel cancer as appropriate. At colonoscopy, approximately 5 out of 10 patients will have a normal exam, 4 out of 10 patients will be found to have polyps, which may be removed due to their premalignant potential, and 1 out of 10 patients will be found to have a cancer. Streptococcus bovis bacteremia and endocarditis is associated with colon cancer in around half of cases. All patients should therefore undergo colonoscopy. Now, referral guidelines. NICE updated the referral guidelines, and the following patients should be referred urgently, which means within 2 weeks, to colorectal services for investigations. Patients more than 25 years with unexplained weight loss and abdominal pain. Patients more than 50 years with unexplained rectal bleeding. Patients more than 60 years with iron deficiency anemia or change in bowel habit. And when tests show occult blood in their feces, an urgent referral within 2 weeks should be considered if there is a rectal or abdominal mass, if there is an unexplained anal mass or anal ulceration, or in patient less than 50 years with rectal bleeding, and any of the following unexplained symptoms or finding: abdominal pain, change in bowel habit, weight loss, and iron deficiency anemia. FOBT, fecal occult blood testing, should be offered to patients with more than 50 years with unexplained abdominal pain or weight loss, patients less than 60 years with changes in their bowel habit or iron deficiency anemia, patients more than 60 years who have anemia even in the absence of iron deficiency. Now, what about the features? In fact, colorectal cancer on the left side of the body typically presents with bright red rectal bleeding. Colorectal cancer on the right side of the body typically presents with iron deficiency anemia and melena. Colorectal cancer is the most common cause of iron deficiency anemia in postmenopausal women or in men aged 50 or older. In the descending colon, colorectal cancer presents as colicky pain and hematochezia. Colorectal cancer on the left side of the body typically presents with obstruction, and in the ascending colon, colorectal cancer presents as an exophytic mass with iron deficiency anemia and weight loss. You should remember that there are some drugs that reduce the risk of colon cancer, like vitamin D, aspirin, and NSAIDs. The management of metastatic lesions. In fact, colorectal carcinoma is one of the only oncological diseases where the presence of a metastatic deposit can be treated with curative intent. A solitary liver lesion should be surgically resected. The Duke's staging system has now largely been replaced with the TNM system. This was provided by the SSSM Study Smart series for Mrcp, your easy way to easy pass. Remember that our references of the Golden Notes are Davidson, Oxford Handbook Series, Essential Revision Notes for Mrcp, and Notes and Notes. Don't forget to follow us on Facebook, Telegram, and YouTube channel. And remember, with SSSM, you're always in a safe zone and you're always the winner. Thank you very much.